So we are on. Hi, Doctor. Thank you for being here. Everybody who's watching this with me today is Dr. Mitsy Novakovic. She graduated from Siberia and then moved to United States. Sorry? Serbia.
Serbia.
Serbia. Sorry. She graduated from Serbia, then moved to United States. She graduated from advanced standing DDS from UIC in 2020. And then she moved forward to continue with her residency in Endodontics at UIC in Chicago. So thank you for being here, Doctor, and thank you for your time. Thank you.
Thank you for having me here. It is my pleasure. And yeah, that Siberia and Syria confusion happen a lot. So sometimes I have to correct people like, no, it's Serbia.
Okay, thank you. I'm going to ask you this question. Do you got your vaccinations, right, for the COVID-19?
Actually, yes. I got my first dose on New Year's Eve, and my second dose is due this week.
Okay, how was it, like the first shot?
Actually, it wasn't bad at all. The only thing I felt was like my shoulder was a little sore the day of the injection, and then after that, I've been fine. I've heard that people have a little bit more severe reactions to the second dose, so we'll see how will that go.
Was it Pfizer or Moderna?
The one that I got was Pfizer.
Okay, I actually had Moderna like yesterday, and I had really bad fever last night. Some of the people, I think Pfizer has been going better. So, okay. So moving to some of the questions, just to let people know, I met Dr. Mitsy at UIC when I went there for open house. She was one of the last year, I think it was a committee or the panel. You were a part of that, if I'm correct. And can you tell us a little about your journey and in dentistry and how you ended up in it and then moving to United States and coming all the way up here?
No problem. So I graduated from dental school in 2011. During my studies over there, I fell in love with oral surgery, and I thought I will be an oral surgeon. However, in my country, you had to do a year of GPR residency in order to get a license. It's not optional; it's mandatory, and then you actually have to work for 2 years. It's a requirement prior to applying to any residency. A little bit different than here. So I had no other options but to actually work as a GD for 2 years. And I did. Even though my focus was oral surgery, I ended up working in a private practice office where actually main work was mainly focusing on full mouth rehab cases, fixed prost, combined fixed and removable prost implants cases, and so on. So I ended up getting trained and getting really comfortable at doing extensive prosthodontic work and no oral surgery whatsoever. And that's how I got exposed to a little bit more serious endo, and I started doing some endo and prost. In 2015, I moved to the United States, and I actually had almost 2 years outside of dentistry. So when I decided I'm going to go to advanced standing and pursue licensure here, that was in 27. Well, actually, that was early 2017. I had to work really hard and study a lot to be able to pass both MBD Part 1 and 2 and actually applied for UIC in time. And I somehow, got time to submit my application like a few days before the end of the cycle. And I actually ended up getting accepted that year. In the meantime, I worked a little bit as a dental assistant. And I started my program at UIC at 2018. During the program, I realized how much I actually enjoy endo and how different it is compared to my experience overseas. And I decided, you know what, I think I want to be an endodontist. So I
That
applied to Endo, and I got lucky to get accepted the very first year. So here I am in my first year of endodontic residency, and I have to say I'm very happy to be there. So
so
that's
one
my story.
one question you mentioned about 2 years, and most of us who are coming from foreign countries have to deal with this. That for 2 years, you weren't you were out of dentistry when you were in Chicago, right?
Yes,
When you moved.
yes.
How was that period? Like, did you, because all of us go through this, and I just want to know, like, did you have doubts as well whether I would be able to be a dentist in future or not?
Absolutely. It was, now when I reflect back on it, it was one of the hardest times in my life. I think um, even, the hardest time you will have in dental school cannot compare to um, studying for MBDEs and going through all that preparation for applying, and reading about the success stories and failure stories and how competitive it is and what do you have to go through uh, to get accepted, and how much it costs, and bench exams and this and that. It's just it was hard. um, I would say additionally, it was hard going back to studying. I didn't study for a few years. It's been, some time since I graduated. So going back to studying in a new language. My entire education was in Serbian, so getting used to American nomenclature, um, and that was not easy. But I would say, yeah, that was really hard. Nothing after that was as hard as that.
So correct me, but you studied all your dentistry in different language, and then you have to move to English.
Correct, correct.
Wow, wow, that's quite a challenge, I would say. So my question in regards to that, I know a lot of people, even I was there about a year ago, who are in between that phase, like waiting for their silver lining, I would say. What would you advise to them, like who are somewhere in Chicago or New York and working and thinking if they would get in or not?
The only advice I have, well, if I could give an advice to my younger self, I would say, don't stress out. Just try your best. I was, spending time reading all these things on forums. Oh, this is what they're gonna ask you, or they say, okay, they interviewed this many people so far at that school, or this many people so far, or this many got accepted. Oh my God, there's no more spots left, and you just read that, and you get really demoralized and even anxious. What's gonna happen to you? I would say don't pay attention to that. Believe in silver lining. Believe that you will end up where you should end up, and try to give your best and really enjoy the process.
Okay.
Stressing out less and working more without worrying too much is what I would advise myself if I was going through this again.
All right. So one question, one of the reason I wanted to do this interview with you. So I went to I visited Colorado, I visited Indiana, I visited UIC. One of the things that made you stand out in that panel, because you said there, be yourself. Somebody asked you a question, maybe I did, and you were like, the best thing you could do during the whole process is be yourself. And not many people say that. And for I could be wrong, but especially when I talk to female candidates, they are very tense during these process. And I think you're the only person who told everybody, like, be yourself and just keep doing what you're doing. What's the, and that was, I would, very distinct of you. And why do you think that way?
Uh, well, first of all, you can fake it for a little bit, but not for too long. So I think, what we truly are will eventually come out. So instead of trying to impress somebody with what you're not, I would say just try to be natural and be normal, and, just normally pleasant. And, people do tend to recognize um, when you're genuine. And instead of trying to fake it or spin your story around to portray yourself in a better light, or say this or that, just be frank.
So one thing
um,
I'm gonna ask you a bit of a more difficult question. I know it's not easy to find the real self of you are, and it takes time. usually. Like people who say this, like, be yourself. I think for me and for a lot of people I know, it takes time finding the real self of who you are, especially after immigration, because you kind of go in an identity crisis. You try to be American, you're trying to be Pakistani, you're trying to be a lot of stuff. Any input on that? I know it's a very gray zone area, but any input on that side?
That's an excellent question. And now, when I reflect back on how I felt when I moved to United States, there's a certain time of cultural shock for every person. I think for me, one of the most, and it might sound weird, but one of the most intimidating aspects was dealing with people on daily basis. People who smile a lot, people who appreciate small talk. And it's just different. Back in Serbia, when somebody asks you, this is just one example, when somebody asks you how are you, you will probably respond with, oh, you know what, today I have a headache and this and that. Over here, how are you is not a question about your health, it's a greeting, and you respond, well, I'm good, how are you? And that's how a conversation starts. Americans really appreciate being smiling, being upfront, being friendly, being positive. They don't like negativity in everyday life. Just being positive, staying out of the heavy topics of politics and religion, and whatever else is going on at this moment that is not that good. Just being lighthearted and polite and pleasant is one thing that really was strange for me in the beginning. I come from a culture where you don't say please and thank you and I'm sorry that often. Here,
Really?
you do say that. Yeah. It's different. I know, like, if I tell you this, it might sound, oh, Serbian people are rude. We're not rude. It's a little bit different level of communicating. But when I moved here, I learned how to say thank you a little bit more, please, and thank you, please, and I'm sorry, and excuse me. So I would say, just going through that time, what could I advise people? Interact with American people, see how they do, see how they behave, smile. Smiling is really important, especially now when we're wearing masks and we can't show our smiles. You have to smile with your eyes to show it. So that's one thing. That's one thing that I think is probably hardest for people to adapt to. What else could I say?
So I'm actually, a lot of questions are jumping around my head when you're saying all of this. One of the things that you said, be yourself. Now that's a big statement in itself, and I think it's a journey in itself. But somebody who liked surgery, and I'm saying this because I come from somewhat a background similar where I like surgery. You have a different temperament of looking at things, how you deal with stuff, overall, your life approach. Then moving towards endodontics, and I personally feel like, could be wrong, they are on two different extremes of the spectrum most of the time.
Yes, and that's another thing. Sometimes you find your calling, and sometimes your calling finds you. I think what I needed is a broader exposure. Um, I got exposed to oral surgery. I fell in love with oral surgery, and I didn't have an interest in anything else. And then, life exposed me to prost, and I fell in love with prost and endo, and I got mesmerized by endo. And okay, this is what I want to do. So yes, those are very different things. But right now, I think it was just based on my maturity level. I wanted to be a surgeon when I was 21 years old. I didn't realize I wanted to be an endodontist in my late 20s.
All of us
So
do that.
so it was a little bit of a journey of self-discovery right now. Right now, I couldn't imagine being anything else but an endodontist, and it has to do with how much of a perfectionist you are, how much attention to detail you give, and how self-critical you are, really. So
Okay, that's
that's how it happened. It was not something I discovered instantaneously. Endo was not my first love, but it's my true and final love.
but what you said, sometimes you find your calling and sometimes your calling find you. I totally agree with that. That's a very hard statement to make, but only people who have experiences could say that. So one other thing, so one of the really important things, and anybody who's watching this, during my process of applying to school, doctor helped me out by telling me a really good, I would say, suggestion or recommendation about writing supplemental answers is the less you write, the better. Keep it short. And most of us candidates who are coming from different countries, they want to write their whole Rocky movie script in their supplemental answers. They want to tell everything about themselves. So you applied to your residency, you applied to school. Why did you suggest this? Because it really helped me out. That's for sure.
Uh, this is what I'm thinking. If I was choosing out of the pool of candidates, I already know all the people who apply are already competent. They already passed their exams. I can see their GPA. I know what they can do. Do I really want everyone who had perfect 4.0, or do I want people who are promising in different ways? I would probably go for the other. So that's why, if I don't know, I was never in admissions committee, but I'm just saying, if I was there, I would really read everybody's personal statement first. And personal statement really is an opportunity for you to say all the things that you didn't say anywhere else in your CAAPID application. The less you write, the better, because you don't want people yawning, reading it, and losing interest. And you want to capture their attention in first two sentences.
Okay.
You need to start big. And your statement should not be about, why do I want to be in the program? Your statement should focus on why would I as admissions want to accept you in the program? Why would we want you to sell yourself, essentially? So keeping it short, simple, and interesting is the way to go. I think that will say so much more than just reiterating everything from the from other sections of CAP in the personal statement. And that, I think, that's truly one section where you have the chance to say whatever else you didn't. And brevity is the key, as well as trying to make to sound unique, original, interesting. It's hard.
Can you repeat? You said what's the key?
Trying to be brief. Brevity is the key.
Okay.
Brief, short and sweet.
Okay, that's quite a unique perspective. I took your words into practice, but I wasn't thinking that way. But thanks for elaborating on that. Now a little bit about your previous school, like since you mentioned about Serbia a little bit, and like so I have one batch fellow in Colorado from Serbia, and another friend who got into UCLA, but there aren't many people from Serbia yet, and there are few coming in recently in the recent years. So can you tell us something about from back home, and even some message for people who want to come to United States and pursue dentistry?
Well, I can tell you, education over there is different. That's for sure. I would say we study a lot of theory, books after books after books. It's like stacks and stacks of books, and we have a little bit less practice. And I would say the educational system over there is student centered. It's not patient centered. So compared, to UIC, where program is very heavily clinically oriented and patient centered, I do think that patient centered program is better, because it prepares you better for working tomorrow. Well, you will be focusing on your patients and not on the requirements. So this many crowns, I have to complete this many dentures or this many extractions. So I think it prepares you a little bit more for holistic approach. The way dentistry works over there is also different. I would say I have friends over there who, for example, do endo and extractions and prost, and then they specialize ortho, so that they could do ortho, because their idea is to keep everything in-house and refer out less.
Yes.
While over here, you actually want to specialize, and then people will refer to you. So there, culturally, there are differences. Also, economy is different, so we can't really compare, Serbian economy with American economy. Access to care is very different. Culturally, it's very different. I think I already said that, so I'm repeating myself. And It really
culturally?
depends on where you practice. I was lucky to have practiced in a big city in a very
Which city was it?
advanced practice. Belgrade, the capital, a very
Okay.
very advanced practice. If you go to a more rural area, you're probably going to just end up doing extractions and dentures. But again, that was not my experience.
Okay, so you mentioned about UIC. One question is, anybody who wants to apply to UIC, what criteria or stuff they want to keep in mind? I know I could be wrong, correct me if I'm wrong, but I've heard UIC really likes people with dental assistant experience. And
Yes.
the other thing was coming to their open house. That's what I heard until now. But what would you suggest about anybody who want to pursue DDS at UIC?
So yeah, you said that correctly. I do know that admissions committee looks at working as a dental assistant. The longer the better. Paid experiences, of course, ranked higher than volunteering experience. But even shadowing will count. Really, any kind of exposure to dentistry in the United States is really critical. Um, but yes, paid, the longer you work as a paid dental assistant, the higher chances are that you're going to get the interview invite. Another thing that they look at is definitely some volunteering or community service experience. I personally did not have that. I just haven't been in the United States for long enough. But I do know that that is one thing that they definitely appreciate. And I would say those two things. Yes, open house for sure. I don't know if it's critical or not, but if you show interest, and let's say I know the people who have been, through applying through multiple cycles and came to multiple open houses, eventually they did get accepted to UIC.
Okay,
So just showing interest.
one other thing is I this is my observation. I figured out every school in United States, like they have something that they are really proud of. Like some schools are big on research, some are just big on being in a big city because they have a large patient pool. They are one of the oldest school. Colorado is holistic. It's one of the only school in, like, there's no other dental school in the surrounding states, Montana, Idaho. So it's in the middle of nowhere. So what do you think UIC is big on? Like, what do they really like about their school or they're really proud about?
So two things. Number one, diversity. UIC crowd is very, very diverse. In my class had 52 people from 40 different countries.
Wow. Wow.
So you can imagine that. So cultural diversity, ethnic diversity for sure, a huge thing for UIC. And then another thing, as I said, patient-centered program. You get a lot of patient experience. You have no issues completing all your clinical requirements and really get out of school having very, very solid, ground for practicing.
Makes
Those
sense.
two things.
Makes sense. So now coming to your residency. So when you were in your undergrad, do you have, I know it could be over a time period of time, but when did you finally thought, okay, I'm going to try for endodontics now? This is my calling or whatever. What was the point, like in your second year or during what time?
Um, it was actually I started thinking about it towards the end of my second year or my second semester to be precise. But I wasn't really sure. Um, I started thinking about it, but I was thinking, I had so much student loan, I'm going to pay it off. I should work and this and that. And then I think, the breaking point for me was when I realized, I'm ranked number one in the class. And one of my friends really told me, she said, you're one of the smartest people I know. If you don't go out to specialize, who will? I was like, damn. So I got encouragement from few different few different sides, few different friends and mentors. But yeah, it was towards the end of my second year and beginning of the third year.
So you kind of triggered a question in my head, like, how do you be the number one on top of your class? Like, what's the
Uh,
approach to it?
Well, that's a good question, and that's something to strive for if you want to go into residency. Always class ranking is important because that's something that they do look at. I think regardless of the residency, whether it's Endo or OS or whatever else class rank is, do your coursework in time, be professional, practice a lot, study a lot. I would say don't focus on how other people are doing, focus on how you are doing. And read your syllabus, figure out which component weighs how much. And if you have to sometimes, pick and choose what to focus on more. Okay, if this is, 10% of the grade and this is 2% of the grade, maybe I'm going to focus a little bit more to do well on what's 10% of the grade. So sometimes you also have to be a little bit smart about that. But yes, just working hard, focusing, being professional, and
Pretty much be a
yeah.
Superman. That's what you're saying. Be like Christ, right?
No. I mean, I don't want you to think that I'm making it sound as if something that can't be achieved. It can be accomplished. A lot of people, had 4.0, so I wasn't the only one. It's just working and as I said, read your syllabus, focus on which component weighs how much and how much you need to invest, how much work, and work. It's a lot about planning as well.
Okay.
Um,
All right. So the next question, since you said this, how do you manage the work-life balance? So since you're talking about doing so much stuff for school, what about the rest of you, and does it get compromised in
uh,
starting off with dental school, and then we will talk about the residency, which is a whole new level?
Yeah. So I wish I could tell you, oh no, you can balance everything. It's gonna be easy, but that's not the case. Honestly, again, I don't know how is the program that you're currently in. I can speak from UIC perspective. The first 2 semesters are pre-clinics, and then the remaining 5 semesters are clinics. And the first 2 semesters are very, very heavily uh, on didactics and also preclinical labs, a lot of performance exams, preparing for for mannequin boards. So it was a lot of work condensed in 2 semesters, especially the second semester. So if we talk about work-life balance, there was none. It was just work. There was no life, honestly. Many times you don't have time to sleep. You don't see your family or friends. You spend all day in classes, in labs. You stay after the lab to practice for performance exams. You go home late, you study, you come to school early, repeat everything, go to school on weekends to practice. It's just, that's the way life is for those 2 semesters.
Yeah, it's kind of similar. Yeah, I don't want to cry out my life right now, but it's similar right now.
Yeah.
So
But you get used to it, and it's just 2 semesters. Time goes by.
what about the residency? It's how much is the jump in when you come to your residency?
Huge. So residency is a whole new level. Really, you're challenged in so many ways. Residency really challenges you in being a clinician and making your own decisions. And when you're an undergrad, you recognize the level at which point you can't perform a procedure anymore and you need to send to a specialist. Now in residency, you are the specialist, so you don't send it to somebody else. You're the one who does it. You screw up sometimes and you learn how to fix it or how to not fix it or how to deliver bad news and tell the patient, what, I screwed up. This is what happened. This is what we can expect. You learn how to manage your expectation. You learn how to manage their expectation. You learn how to manage complications and how to fix mistakes. So that's one aspect. The other aspect is didactic portion of the residency, which is also a lot more dense than undergrad. In undergrad, you study from your lectures, from your PowerPoints, a little bit of book chapters here and there. Here, you actually read papers all the way from the classic literature from 70 years ago to what's, contemporary and coming out right now. You read a ton of papers every week, I would say 50 or so, maybe more, depending on, the week. You learn how to not only retain and regurgitate information, but also to critically appraise them, to see what is a good research, what is the validity of this research, what is, how should I take this for granted? Is this a good result? Is this not a good? Is it something I can trust? Is it something I can implement? Okay, this has statistical significance. Does it have clinical significance? You learn how to evaluate all those things, and then thirdly, there's also a research portion of the residency where you have to come up with your own original research. What do you have interest in doing? You have to do all your literature search, to design your research protocol, to figure out what's the power of your study, and then to actually do it, and then to interpret results, and then to do all that. So it's a lot of elements that undergrad did not necessarily have. At the same time, I personally feel like it's so much more rewarding because I'm learning so much every day, and I'm extremely grateful that I have the opportunity to be where I am. But yes, many times you feel like there's really no time to sleep.
Did you get time to read books during your undergrad?
Actually, well, yes, I would say mostly during breaks, but not during first 2 semesters. Third semester was also somewhat busy for us because we were practicing for mannequin boards. But after that, it gets a little easier. So yeah, you get to read here and there.
Okay, so one other question that's coming to my mind, when you finally thought you're going to go into endodontics, right? Did rest of the subjects kind of, what would I say, your interest in them kind of subsided? Does that happen? Like, is that something that happens?
Um, well, okay, that's an excellent question. And I would say yes and no. I still, from the perspective of somebody who really cared, in providing the best possible care for all my patients, I made sure to finish all my cases, to do whatever I can for them, to deliver all my dentures. I eventually ended up, doing more dentures than what I needed to to complete my requirements. But at the same time, did I ever think, oh my God, I'm never gonna have to set teeth for a denture again? Yes, of course. And I happily thought, so. I was like, man, in residency, I won't have to do lab work anymore. I was ecstatic about that. Yes.
Yeah, because a lot of people who want to go in specialization, somebody who's ortho oriented, he has a really hard time studying for endodontics, for example, or something like that. And that's what I was thinking. But one other, so if somebody who want to pursue postgrad residency, it could be any of them. So keeping your grades good is one of them. What
Yes.
else do you suggest to them?
Uh, first of all, doing as well as you can in your preclinical endo course, getting good grades on performance exams, showing interest, um, getting to know faculty, residents, getting to I would say one thing that I would really recommend is going to postgraduate endo program in your school and shadowing or assisting surgeries or just regular non-surgical root canal treatments. That's an opportunity to learn a lot. Getting as much clinical experience once you start clinic is also important. One way to do that, at least at UIC, was to volunteer for urgent care rotations. So sometimes, even during the breaks, when you don't have to go to school, I would volunteer for like at least 2 or 3 days off of urgent care and get some root canal patients from there. So trying to do as much as possible. If you have an interesting case, doing a case report, and those are things that you can do during the school. If let's say you get out of school and you're not sure if you want to do endo or not, or you apply and don't get accepted, it's not the end of the world. there are still many ways in which you can make yourself, a desirable candidate for the program. Maybe doing a year of GPR or just practicing for a few years really is sometimes all it takes for, admissions committee to take you more seriously. Because I think, getting broader knowledge of general dentistry and getting bigger exposure to patient care is never a bad thing. It can mean a lot, when you have done a broad variety of dental procedures. It just makes you more competent and, from the perspective of treatment planning, diagnosing, and eventually performing endodontic treatment.
Right.
So, yeah, go ahead.
So people who had breaks in their, like after their DDS, they had a break and then they're applying to residencies. Does it make it more difficult for them to get into?
I don't think so, but I think that's very program specific. To be honest with you, I can speak from the perspective of the school that I am at. UIC. I know that UIC really appreciates experienced people. So if you practice and keep yourself up to date, and just attend AAE meetings, and keep yourself up to date with Endo on demand contact on AAE website. Try to learn as much as you can during that time. I don't think it's a disadvantage. I actually think it's an advantage. So and just I would say make sure that the people that you're going to get letters of recommendation from, let's say they're faculty from your school, make sure that they don't forget you. Come back to school and remind them that you're applying.
Okay. So, all right. I think I asked you a lot of questions regarding dentistry now. Just to ask you, so this is the whole dentistry side, which is overwhelming. But except for that, did you get time to do anything else? Exercise, music, reading, yoga, anything like that in your life that interested you?
Well, yes. Well, for me, one thing that I'm, very particular about is, meditating as often as I can. I can't say I'm doing it every day. I'm not that well disciplined, but I try to, and that has something that helped me out a lot. If I meditate in the morning, I just feel better throughout the day. So that's one practice that I've tried to keep for these years. Exercising is important. I don't exercise on a regular basis as well because I'm not as well organized, so I can't make time for it every day. But yes, keeping yourself healthy is also important. Um, Nowadays I can't say that we can have social lives because because of the
Yeah.
pandemic that's going on, but hopefully that will pick up at some point. So yeah, just keeping yourself healthy mentally and physically. So
How
um,
do you did you came across neck pains and back pain, like especially because of endodontics? You're sitting on chair for like what's a day?
that's a great question. I still think that endodontics is honestly the most ergonomic specialty there is. So I
Yeah.
haven't experienced any. Yeah, I haven't experienced any back pain or neck pain um, after working all day doing multiple root canals. I would say sometimes sitting on the bed and studying is what causes pain more than actually working. But yeah, I do think that endo is the most ergonomic specialty there is.
All right, thank you. And is there anything else? Okay, one question. I know this is a bit off the topic, but I know a lot of friends, candidates who are applying to schools and they haven't got an invitation and they are going through some rough phases overall in life and academics as well. And most of people imagine if they get into DDS, every problem is going to be dealt with. It's going to be much more smoother in life. How much do you think is that true?
Um, huh. When I think back, I think honestly that my life changed for better the moment I got accepted into advanced
How
ending
come?
program.
How come was
And,
that?
and Um, well, I can say that before that, I was very lonely here and I didn't have friends. And when I got accepted, I just met other people who are immigrants like myself. And I don't know, we just formed a bond, and I really found my family in advanced standing program. And I think, life has become so much better because all of a sudden I had all these people that I could at least partially rely on, and I didn't feel as lonely as before. So I think that everything before that was so much harder than after that. Now, that doesn't mean that there won't be any problems. But I do think that really getting accepted into the program is the light at the end of the tunnel, and that things will get better. And that's something that I would really want to emphasize to anybody who may be going through a hard time. The things will get better. Just push through, work very hard, get your application as good as you can make it, and believe that you will end up where you're supposed to end up when it's meant to happen, and things will get better.
All right. That's a very unique perspective. I wasn't thinking in that way, but thank you for sharing that, doctor. You know what? After talking to you, there are two things happening in my brain. One is I want to ask you more questions, and second is close down everything and go and study. So I think I would go with the lateral one now. And thank you for your time. Really appreciate it. I know your time is really precious right now, and hopefully people who are watching may get something meaningful out of this. And I wish you all the best, doctor.
Thank you so much. Thank you really for having me. It has been my pleasure and privilege, and I wish you all the luck in your future endeavors. I have no doubts you'll be very, very successful, and I'm very glad I met you and we stayed in touch. And I wish all the luck to anybody who's watching this. And I just want to reiterate one more time that there is light at the end of the tunnel. Things will get better.
Oh, that's so mystic. You kind of, when you say it, I start thinking about it. But thank you. Thank you. That's really meaningful. And thank you very much. See you soon. Take care.
See you soon. Take care.
Bye.